dear colleagues. My name is Anastasiia Lapshyna. I'm aesthetic doctor and KOL of Innoaesthetics laboratory. Today we will have really very interesting webinar regarding new combinations of the exosomes with the TDS products. Please let me know if you can see the presentation, if you can hear me well. And I guess we can start. If you will have any questions, then you can write it in the chat and I will answer all your questions at the end of the webinar. You know that some period ago, we already launched INNO-EXOMA EXO-SKIN. And just from the launching, we've got really a lot of questions regarding the possibility of combination of INNO-EXOMA EXO-SKIN with TDS products. And of course, this is really important question because we would like to have our treatments really personalized. So of course, there are a lot of indications for the exosomes, its regeneration, rejuvenation, and so on. But most of our patients have some other specific aesthetic problems. That could be hyperpigmentation, that can be acne, post-acne scars, and so on. So in order to make the treatment more personalized and in order to have more indications for the treatment, to have better results, we already made specific protocols of the combinations of INNO-EXOMA EXO-SKIN with RESTRUCTURER, TIGF, and Matrix. So we already conducted clinical studies that I will share with you today. We've checked everything, the possibility of this combination, are there any possible complications, and so on. So today, I would like to share with you this experience in order to make your professional treatments more effective. So, as you know, INNO-EXOMA EXO-SKIN is the regenerative complex, which is 100% synthetic. So it means that we do not use the exosomes of the animal or human or plant origin. And of course, this is very important for us because it makes our treatment completely safe. So INNO-EXOMA EXO-SKIN was produced with the help of NARBEX biotechnology. This is non-animal regenerative bioengineering exosomes. What we have inside these exosomes. So the composition of the exosomes are mostly amino acids that we need in order to produce the main proteins like collagen, elastic. Also, we need it for the production of some antioxidants like glutathione, for example. So the main amino acids that we have in the composition of the INNO-EXOMA would be lysine, leucine, which is very important for the synthesis of collagen. Also, it contains arginine, which improves the skin texture, so it's helping with the regeneration of the skin. We have here histidine, which is crucial for the synthesis of filaggrin, which is the foundation of the natural moisturizing factor, which is crucial for the hydration of the skin. Tryptophan, which is the precursor of antioxidants, so in such a way we can protect the skin also from the oxidative stress. Besides the amino acids, we also have specific peptides inside these INNO-EXOMA EXO-SKIN. So these peptides, due to the specific technology, due to the changes of the pH and a specific ionic force, can create a circle structure. So this is actually what leads to the circle structure of the exosome-like product. The main functions of the peptides that are in this exosome-like product, mostly those peptides which we need in order to stimulate collagen synthesis, also for the restructurization of the dermal matrix, for the stimulation of the growth of the keratinocytes, and also we have the pentapeptide 5, which is crucial for the acceleration and stimulation of the growth of the hair. That is why INNO-EXOMA we also can use for the patients with some trichological issues. So now let's see what kind of combinations we can have. We already conducted clinical studies with 3 products. These are Restructurer, Matrix, and TIGF. I'm sure that you are already familiar with these TDS products. First of all, Restructurer. The active ingredients are vitamin C, glutathione, orgatine, and lipoic acid. So mostly this is the product that we usually use in order to prevent aging, and also Restructurer is a great product for the treatment of hyperpigmentation. So vitamin C is a very potential antioxidant. That's why it will slow down the process of oxidation of the melanins. In such a way, we can work with melasma or any other pigmented lesions. Also, vitamin C is crucial for the synthesis of collagen. So that's why we use it for both, for the improvement of the structure of the skin and also for the lightening of the skin. Glutathione is a very, very potential antioxidant. It's one of the most crucial antioxidants in our body, but unfortunately with the age we have less and less levels of glutathione, so we need to get it from the outside. That's why with the help of glutathione, we protect the cells from any kind of damage from free radicals or from UV radiation, for example. And also orgatine and lipoic acid are important antioxidants which are protecting our skin. Matrix is the great product for the rejuvenation and hydration of the skin. It contains hyaluronic acid, but hyaluronic acid of not very high concentration or not very high molecular weight. This is very crucial for us, especially when we are working with the delicate areas like periorbital area, for example, or if we are working with the skin of the neck, not to have any edemas after the treatment, for example. Also, it contains organic silicone, which is important for the structure of the skin, so it improves the structure and makes it more firm. And sodium pyruvate is necessary for the energy. So while stimulating all the processes in the skin, we also need some energy for the correct functioning. And TIGF is the stimulation of the growth factors. So here we have hitazan, elastin, collagen, peptides, chondroitin. So this is the great product for the different kind of symptoms of aging. Mostly we are using that in order to use our own potential for the rejuvenation, the potential of our skin, for the production of synthesis of collagen, to improve the quality of skin, and also to get rid from the wrinkles and fine lines. So what is the advantage of the combination of INNO-EXOMA EXO-SKIN with INNO-TDS products? First of all, with such kind of combination, you can get really immediate results, because we understand that with the exosomes, with some kind of stimulation of the fibroblast, we need to wait for some time for the effect. While combining with TDS, we can get faster result. We can get faster lightening effect. We can get faster effect of moisturizing of the skin, hydration effect, improvement of the quality of the skin. So it really will help you to see the result much faster. Also, such results will more long lasting, because here we have not just the stimulation, here we have also some ingredients which would be like the building materials for proteins, for example. And that makes our therapy really personalized, because as I've already mentioned, most of the patients are not coming for us just for the rejuvenation, not just for anti-aging effect. So most of them have some specific aesthetic issues that can be acne lesions, that can be more superficial or deep wrinkles, hyperpigmentation, post-acne scars, and so on. So of course it would be great to have just in one treatment to work with the different kind of problematic of our patient. So we already have conducted the studies because we needed to check is the combination is really working, and also if it's possible to combine such products, because we need specific pH, we need osmolarity, we needed to check the time during which we can use the product, during which it would be active, and we already have the results which shows us that such kind of combination can be really active, and we can use it the same methods as we are using in INNO-EXOMA EXO-SKIN. So what would be the main indications for such kind of treatments? Combination of INNO-EXOMA with the restructurer, we mostly recommend for the prevention of aging, so you can use it for young patients. Also, it is recommended for those who are prone to damage of the skin with the free radicals, for the smokers, for example. We also can use it for the patient with the hyperpigmentation. So in the case your patient have lentigines or melasma or post-inflammatory hyperpigmentation, it would be recommended to use EXO-SKIN with the restructurer. The next combination, which is INNO-EXOMA EXO-SKIN and matrix, is mostly recommended for the improvement of the quality of the skin, also for those patients who have fine lines, who have a lot of wrinkles, for those patients who need hydration of the skin. So if your patient has dry skin, for example, then the combination with matrix would be really great. If you want to work specifically with the periorbital area, with the neck, with the delicate areas where we need to firm the skin, where we need a bit of lifting effect, there you also can use the combination with the matrix. And TIGF is the great combination for both, for prevention of aging and already for anti-aging treatment. It makes the skin more firm. Visually, you can see that the fine lines or more deep wrinkles are not so significant. So in any case, for the improvement of the quality of skin, working with some imperfections, with the post-acne scars, for example, you also can use combination with TIGF. So the main benefits which you are getting from the combination with the restructurer, first of all, this is antioxidant action, and that is actually great. I think nowadays, when the summer is coming, when already the days are very sunny, the combination with the restructurer would be really popular and demanded by the patient, because now we already started to prepare the skin for summer. So when we are starting to use restructurer and active antioxidants like vitamin C, like glutathione, before the period of active sun, it will protect the skin from the UV radiation, and also it will make the risk of having some hyperpigmentation lesions less. It also will prevent premature aging due to the action of active antioxidants and improve the skin structure. Today, I also will show you really great results of the combination of INNO-EXOMA with restructurer in the cases with post-acne scars. So here again, the effect would be due to vitamin C, which is the precursor and very important cofactor of the synthesis of collagen. With the matrix, you are getting more firm skin, you are rejuvenating the skin, and you also can work with the dry skin, because here we have hyaluronic acid that will help to moisturize and hydrate the skin. And TIGF, the main effects that we are getting is the powerful revitalizing effect due to the peptides and amino acids additionally that we have in this product. So the recommended session would be 4 sessions with 21 days interval, and application, which is usually recommended, is the application with the microneedling. So first we need to reconstitute the INNO-EXOMA EXO-SKIN. Here we already don't need to use saline solution like we were doing that before. So now you have to apply TDS. You just take in TDS to the syringe, and then you put the TDS product inside the vial with the exo exosomes. Then you gently mix it like we were doing before with the saline solution, and after that, the solution is ready for use and you can use it during 24 hours. So here you can have the video of the mixing of the product, which is actually very easy. So we are taking 2.5 ml of matrix, restructure, or TIGF. We are gently mixing that. And it's ready for use. So as you can see, we have 2.5 milliliters. And applying it with the micro needling, with the depth depending on the indication. So you can make it more superficial, you can make it more deep. In the case of post-acne scars, for example. So here you can see some results that we already achieved with the combination of EXOMA EXO-SKIN with restructurer. So here is the young patient. The main effect that we are seeing here after the 4th session would be improvement of the texture of the skin. And also we can see that the fine lines and superficial wrinkles are less visible after the treatment. Here we can see the decrease in the visuality of the hyperpigmentation on 0.9%, which is really good result after 4 sessions. Again, young patient with the improvement of the texture of the skin, less fine lines. Improvement of the firming of the skin, the turgidity of the skin, and less hyperpigmentation, 0.7% decrease in the hyperpigmented lesion. Here is the great result of my Ukrainian colleague. This is treatment of post-acne. And here was just one session of the combination of the eczema with restructure, and you can see really good results. So it's improvement of the quality of the skin, really less of acne lesions. But the technique which was used here was micropapule technique. So if you can use some kind of classic mesotherapy treatments techniques, then you also can use micropapule technique. So here again, acne lesion. This is the patient after 4 sessions with the symptoms of aging, with the sagging skin, and we can see the improvement, more even skin tone, a bit lifting effect, improvement of the quality of skin. Patient with 2 sessions with microneedling of combination of eczema with restructure again. Some results with the matrix. So 4 sessions with a 21-day interval, and we can see more even skin tone. Even here you can notice that the pigmentation is less visible, which is really great. So even after matrix, of course, we are getting the results not because of the TDS. You remember that with the help of EXO-SKIN, we also just with the mono product, we can work with the hyperpigmentation because due to the regenerative effect and due to the fighting with the inflammation, we also can get some lightening effect. So this is really great improvement. Less hyperpigmentation, the brown areas are less visible. And also with the matrix, we can see that the vectors are already directed up and to the outer parts of the face. So in this case, we are getting also some firming and lifting effect. 4 sessions with the microneedling, improvement of the quality of skin, less visible pores, less visible fine lines, especially pay attention to the periorbital area. We can see that the wrinkles are more superficial, so also we can evaluate it here, that the level of the fine lines is really lower, and also a great improvement regarding the opened pores. And the combination of EXO-SKIN with TIGF. So here is the patient where we got really great improvement regarding the microcirculation, because this is the patient who is prone to rosacea. And just with the improvement of the quality of skin and improvement the barrier function of the skin, we are getting a really great result with the rosacea lesions. So that combination, and again, the effect of the anti-inflammatory effect are really great. Patient with the fine lines, 4 sessions with the microneedling, improvement of the quality of skin, fine lines are less evident, the skin is more firm. So as you can see, the results are really great. Now you have the opportunity to have this personalized treatment in clinic, to have, let's say, double effect after the session. But of course, now we have the question how to maintain the result that you already obtained. So what we can recommend to our patient. And here I would like to share with you some recommendations regarding the products that we are going to recommend our patients to use at home. And of course, that would be the products from our Epigen line. So as you know, epigenetics is the science which is trying and finding the answers regarding how we can change the expression of some kind of genes without, of course, changing the DNA. So it's very interesting because when we are discussing epigenetic and how it works and how work different epigenetic active ingredients and what it means for us, we usually have this very simple example. For example, if there are 2 twins which are completely the same with the same DNA, we understand that they are aging in the different ways. So it's possible that when they are already in their 40s, they would be a bit different. One of them can be slimmer, the other can have more hyperpigmentation, there would be more wrinkles on the face of one of them. So why it is happening if they haven't the same DNA? So it's happening because obviously there are some factors that can change the expression of the genes that we already have. So in some period of time, some kind of our genes can be on mode or they can be on the off mode. It's the same also when we have the example with the caterpillar and butterfly. This is the same insect, but why it looks completely different in the different periods of its life, let's say, because some genes are sleeping for a certain period, and after that, these genes are waking up and maybe the other genes are off. So this is something that is very important and interesting for the medicine, because epigenetics is also such a field of science which helps us to understand different genetic diseases, and also it helps to prevent these genetic diseases. But also we use epigenetic in the aesthetic medicine. So if there is a possibility to change somehow our epigenetic clocks to make our cell live longer life or functioning better, that is of course very important for the quality of skin. So that's why nowadays more and more we are using products with the epigenetic active ingredients. So of course we understand that there are factors which are really crucial and very important, like our way of life. Are we active? Are we doing sports? Where we live? What is the temperature? Are we open to sun exposure? And so on. But it's great that we have the possibility to use additionally the products for the skin, which will modify the expression of our genes, and we will keep silent those genes which are responsible for the maturation, that are responsible for the hyperpigmentation or inflammation, and we can turn on and activate some kind of gene which are responsible for the regeneration, for the synthesis of collagen, of hyaluronic acid, for the restructurization of the extracellular matrix, and so on. So that's why for the home treatment for our patient, we recommend to use the products from the Epigen line. As you know, here we have several serums, and I would like to remind you, if you are already familiar, or maybe to introduce you. First serum, which is Age Perfection Serum, which is recommended for the prevention of aging or already for the symptoms of aging. So this is the serum which can strengthen the barrier function. It's also crucial for the stimulation of synthesis of our own hyaluronic acid in order to prevent transepidermal water loss. Also, it protects the DNA from the oxidative damage, so from the action of the free radicals that leads to the better functioning of the cell, and we stimulate synthesis of collagen. So all the products of Epigen line will always contain epigenetic ingredients, which would be the same in every serum. So here we have Narcissus tazeta bulb extract, Schisandra chinesis fruit extract, and also tetrapeptide 26, which improve the integrity and structure of the skin, which balance the cellular differentiation of the cells, hydrate the skin, improve barrier function, and protect the skin from the UV radiation. But it also contains extra active principles to prevent aging. So here again, we have vitamin C, which is a very potential antioxidant and also the cofactor of synthesis of collagen. Here we also have peptides, which will balance or low down the level of inflammation. And here we can say that this is also the prevention of the inflammaging. As you know, the term inflammaging we are using when we are referring to the chronic inflammation, which is leading to the symptoms of aging. Also, these peptides will reduce the transepidermal water loss, so we can keep, we can reinforce our barrier function, and we can keep water inside, and it will enhance the synthesis of all the types of the collagen. And also here we have some oils and plant extracts which work more or less similar to retinol, but at the same time it's completely safe. So that is why this serum is possible to use during summer, for example. Of course, it is always recommended to use sun protection, and it doesn't matter are you using at home acids, are you doing any professional treatments, we always recommend to use sun protection. But in this case, such kind of home treatment would be really completely safe even during summer periods. And also such kind of home treatment can be used for any skin, even for sensitive skin, which is usually, for example, in such cases, it's impossible to use retinol mostly because skin is very reactive. We can get some kind of redness, we can get some kind of irritation. So with the Age Perfection Serum, you can be completely safe, and you can for sure recommend it for the patients, even with the sensitive skin. Antiox Serum. Again, the serum from the Epigen line, so it also will contain the same epigenetic ingredients, but here we have more active antioxidants. So this is the great product which can be recommended for the patients with the hyperpigmentation, for the patients, for the smokers, for example, before summer, to prepare the skin for UV radiation and to prevent hyperpigmentation. For the patients who already have hyperpigmentation, you also can use Antiox which is again very delicate product. So here you can see the same epigenetic ingredients: Narcissus tarzetta bulb extract, Schisandra chinesis, and tetrapeptide 26, and also a blend of really active antioxidants like vitamin C, like mimosa extract, and also the other plant extract together with gluconolactone, which we need in order to reinforce our barrier function of the skin, and also to protect the skin from the UV radiation and from any kind of damage which can be caused by free radicals. So those serums can be used every day, in the evening and in the morning, 2 times a day, for any types of the skin. So it can be used for dry skin, for oily skin, for sensitive skin. And after that, if needed, in 10 minutes, for example, you also can recommend your patient to use the cream for hydration. So normally we use also the product from the Epigen line, which is Urban Day Cream. Also, it contains the ingredients for the sun protection. So that is great. During the day, we can protect the skin with the SPF 20. So again, which kind of professional treatments you can conduct in the clinic? That would be combination of the INNO-EXOMA EXO-SKIN with the 3 products. So now we already have conducted studies with the 3 products, and we didn't get any side effects, any kind of complications. The effects are really great. So we can see the changes of the skin just after 4 treatments. So these combinations can be with the restructurer, TIGF, and matrix, and you will choose the product depending on the aesthetic issues of the skin of your patient. So with the hyperpigmentation for more young skin, in the cases of post-acne scars, for example, it would be more effective to have INNO-EXOMA with the restructurer. When you need more hydration, when you want to firm the skin, when you work with the mature skin, with the wrinkling morphotype, for example, then the combination of INNO-EXOMA with the matrix would be great. And TIGF you actually can use in the both cases. So if you want to prevent aging, if you want to stimulate the self potential of the skin to activate the cells, to activate fibroblasts, you can work with TIGF, and as you could see, it gave really great results even in the cases of rosacea. It improves the quality of skin. We can see less fine lines, less wrinkles. And after that, your patients would use at home Age Perfection Serum or Antiox Serum in order to maintain the result of the treatment, in order to have the result longer. So both of these serums, they can use actually all year round. You can just switch from one to another. First, you can start, for example, with the Antiox Serum in order to have antioxidant effect, in order to prevent hyperpigmentation, and in order to protect the skin. And then you can switch to Age Perfection Serum in order to have prevention or already anti-aging treatment. So I'm really happy that now in our portfolio we have these great combinations which will make your treatment more effective, that will make when you will get really faster results, when you will get immediate results, really long-lasting result. I think that in future we will have more studies, because of course there could be much more combinations in order to work with the specific issues of the patient. So if you have any questions, please write them in the chat. When I look at the advantages of both, the products from Epigen, I would say that Antiox is great match with EXO-SKIN and RESTRUCTURER. Is this also an option, or is the Matrix a better option? Everything depends on the problem of the patient, depends on the indication. Of course, Antiox is a great match with the RESTRUCTURER because both of them are antioxidants. But if you already have, for example, so if the patient have mainly issues with the hyperpigmentation or damaged skin, which is damaged with the UV radiation, then of course we would get the RESTRUCTURER together with Antiox. But in the case, for example, you're having professional treatment with the RESTRUCTURER, but you would like to have more anti-aging treatment at home, then in that case, you will recommend your patient to use age perfection serums. And also you can use both of them, like I've already mentioned. You can start with the antioxidant and then you can switch to anti-aging treatment, which is also giving great results. Why 4 sessions? Because with exosomes it is 3 with interval of 3 weeks. So we are talking about 4 sessions because here we are working with the specific problem. When we are just using the exosomes for the regeneration, for the anti-aging effect, for example, then just with the exosomes for the stimulation of the cells, that would be enough 3 sessions. But if you're already working for the hydration of the skin, so you need additionally some hyaluronic acid. If you're working with the hyperpigmentation, so you need the effect of the antioxidants to block or to slow down the process of the oxidation of melanin. So here you would usually need a bit more sessions. But if the indications would be the same, for example, you are working just for the stimulation of the skin, for the stimulation of the regeneration of the skin without any specific issues, then again, 3 sessions, that can be completely enough. What microneedling depths do you use for acne lesions? So first of all, with acne lesions, be very careful because the results which I showed to you, that was mostly post-acne lesions. That was mostly post-acne scars. With the post-acne scars, we can work more deeply. So that can be the depths between 2.5 millimeters up to 2 millimeters, depending on the scars and depending on the depth of the scars. With the acne, we should work more gently, and also with the active inflamed acne, inflamed form, I would recommend to use EXO-SKIN even topically. Also, to do your professional treatments, maybe using some peelings, and only after that, when you will not have this significant inflammation on the skin, you already can start to do the to use microneedling. And in this case, the depth of using of microneedling would be around 0.2, 0.3 millimeters. Do you use 2 milliliters from the TDS ampules, or do you use more? For example, the RESTRUCTURER is a very watery substance, and 2 milliliters might not be enough to do the lighting technique. Well, mostly we are using 2.5 milliliters of the product. You can use more, but what is happening when you are using more? So if you are gonna use, for example, more product for more areas, then you also need the second vial of EXOMA EXO-SKIN, because just adding more product for the reconstitution of the exosomes, like for example 5 milliliters, you are getting the concentration of the exosomes less. So if you need to work with more areas, if you want to use more TDS product, remember that you, in one vial of the EXO-SKIN, you always have the same concentration. So in order to be more active, you would need the second vial. How help reduce pigmentation melasma without laser? So this is a great question, but actually this is the question maybe for the whole webinar. In general, I can say that first of all, when we are using laser for the treatment of hyperpigmentation, and mostly that is dermal hyperpigmentation, we have to remember that this is also some kind of damaging of the skin. So I'm sure that you've seen a lot of complications after lasers. So it's really some treatment which should be conducted in a really proper and safe way. And after such kind of treatment, we need also home treatment for the patient in order to stimulate the regeneration of the skin, and this is also the prevention of the further dermal hyperpigmentation. That's why all the concepts that we have in Innoaesthetics, that we have also in our Meline brand, which is specifically formulated for the treatment of different kinds of hyperpigmentation, is the concept of safe treatment. So we are influencing all the steps of melanogenesis and professionally in clinic, and after that we continue the treatment at home. It's not possible to work with the hyperpigmentation without home treatment, because any treatment that we are doing professionally is a kind of damage. So it can be peeling, it can be microneedling, it can be injection. And in the case when the melanocytes of the patients are already hyperactive, it's crucial to low down the activity of the melanocyte after the treatment. So the concept without lasers, there are concepts of the treatment of hyperpigmentation, which is professional treatment using specific ingredients for blocking the process of maturation of the pigment on all the steps, and also home treatment for maintain it. How about combination of Hair Vital? It would be, it's something that we are checking now and doing such kind of combinations in order to give you really very potential and effective treatments in the case of trichological issues of the patients. We didn't see any kind of side effects after microneedling with the combination of INNO-EXOMA with RESTRUCTURER matrix and TIGF. So the reactions were very predictable, a bit redness and after microneedling that we usually have. So there were no any kind of side effects. May I combine with all other mesotherapy? Best results with dermapen or injectable? We continue conducting the clinical trials with the combination with other ingredients. So we need to check it, because we need to be sure that the product is really active after such kind of combinations, because the products have different pH, they have different osmolarity. So to give you another active and for sure safe protocols, we are still conducting the other clinical studies. So now for sure we can use those 3 products that we were discussing today, but in future I'm sure we will give you more protocols. Best results with dermapen or injectable? Well, I wouldn't say that there is a significant difference between the injection and microneedling. Also, as you know, this product are recommended, like officially are recommended to use with the microneedling, so just superficial using. It depends on the restrictions and certification in your country. So I don't know if you can inject it in your country, but just technically, if you can inject, then what difference you can see? For example, in the case of really dry skin, for example, or dehydrated skin, when we are using matrix, then papule technique can give you better results, because you are injecting the product just into dermis. and you're making like you're just working with the targeted area. You also can bind some water inside. So in that cases, maybe, yeah, you can see a more significant or faster result. But in general, I wouldn't say that there is really a significant difference between that techniques. If you're using Mazagon, then it can be also used for that. The possible side effects of the combination. So we didn't see any side effects of the combinations, but in any case, while using the products with microneedling, the side effects can be associated with any kind of allergic reaction of the patient to any ingredient that you have inside. So you just have to check beforehand if your patient is allergic to something. And mainly that's all. Such side effect like bruises, for example, also can be if you're injecting the product, but it's not associated with the product, it's associated with the technique you are using. The depths we already discussed. Can you combine 3 INNO-TDS in one session? Well, 3 TDS in one session, I wouldn't recommend you to combine in one syringe. Mainly, even when we are using 2 TDS in one session by combining in one syringe, this is not the recommendation. So if you want to use 2 products of TDS in one session, then it would be better to do it in different syringes. So, or you inject it one by one, or you make the first layer with one product and working with microneedling, and the second layer with another product working with the microneedling. You are waiting for the absorption of the product, and then you are using the second layer. That would be better, because while combining it in the syringe, that's the question of the pH, osmolarity of the product, because you are getting completely new one. That is why before recommending you combination of INNO-EXOMA together with TDS products, we needed to conduct chemical studies, clinical studies. You can use also the product after laser treatment. INNO-EXOMA, well, you can use it even without the combination with TDS. You can use it just like a mono product after any kind of damage and treatment. So if you are working with the radio frequency, microneedling radio frequency, if you're working with the laser, so everything which is associated with the damage of the skin, after such kind of treatment for the stimulation of the regeneration of the tissues, you can use INNO-EXOMA with or without combination with TDS. Well, there are a lot of questions about treatment of hyperpigmentation, and I guess we will need to organize a webinar with Milan, because we have this really great system of treatment of hyperpigmentation, and it's really great because the concept is also differentiative. So here we can work with the different types of the hyperpigmentation. We have different products for different phototypes, different products for different areas, for example, periorbital area, intimate area, and this is really great, which I recommend you. Can we do micropapule technique in the under eye? We can do micropapule technique in the under eye, but here you always have a risk of the edema after the treatment. So this is a very delicate area. We also don't have subcutaneous tissues here. The skin is really very thin. That is why mostly in the periorbital area, we are using Napash technique. But if the skin is dehydrated, then micropapule technique is also possible. We also can use exosomes in the periorbital area, of course. Matrix for under eye in combo with exoskin microneedling. So with the periorbital area, you can use Napash technique, you can use micropapule technique, and you can use microneedling. Everything depends on the indications and the skin of the patient. So if you if there are any risk, for example, if your patient is prone to swelling, then I wouldn't recommend you to do papule technique, for example. Then microneedling would be much better. Also for the stimulation of the skin, not just for the hydration. Microneedling would be better because with the microneedling you also have the effect of the needles. With the papule technique, it's mostly the effect that you are injecting the product more deeply, and you are injected to the one specific point more product than you are delivering with the microneedling. So it depends. In the case you're afraid of swelling, don't use micropapules. In the case that's not an issue, you can work. The other combination, except these three products, are not the clinical trials and chemical trials are not ready yet. That's why I cannot recommend you other combinations except matrix, TIGF, and restructurer. ID ampule of Milan, safe to combine. I would say that I know, like I have the experience of combining INNO-EXOMA with ID, and I had great results. But that is just my experience and the experience of some other colleagues. I cannot like prove that really you can use that, and that is also the protocols that we will think about and try to conduct the trials in order to give you this protocol. Suggestion of depth of microneedling in under eye. In under eye, that would be around 0.2 millimeters. That would be enough in the periorbital area because the skin is really very, very thin in this area. Thank you very much for your questions. That was really great. If you will have any other questions, you already can, you always can contact the Skin Academy and we will provide you with all necessary information. You also can get in touch with the distributor in your country in order to get any kind of information files, to get some answers if you really have questions, because I'm sure when you will start to work with such kind of protocols, you already will have a lot of great results, which you also can share with us. You maybe will have some questions. So thank you very much. Thank you very much for your time. Thank you very much for your attention. And I hope to see you soon on our next webinars. Have a great day. Have a great evening. Thank you. Bye.